Hello, everybody, and welcome back. This is Nurse Eunice with Florida Training Academy, and in this evening's video, we're going to be covering CNA and practice test questions to help you care for patients in the hospital. That is right. And hello, everybody who's already in the chat. It is so good to see you all, and as we do in every video, we'll give you about 10 seconds to receive your notifications, and we will get started shortly. Hi, Myla. Bonita, there's so many of you all in there. Antillas, see you in a few minutes. All right, so we have about 50 people joining us right now, and I'm sure there'll be at least 100 more. So let's get ready for question. Hey, Morville. Hey, Veronica. Hey, Vanilla. So many of you all. Good evening, everybody. All right, so welcome, future CNAs and patient care technicians. I'm Nurse Eunice. Hi. And in today's video, we're diving into a live practice test focused on hospital patient care. Now, before we jump into the questions, let's quickly talk about the differences between caring for patients in long-term care facilities versus those who are in a hospital setting. So in long-term care, you're usually working with the same residents every day. You build relationships, follow routines, and assist with activities of daily living, such as bathing, dressing, and meals. However, once you're a CNA with experience, you may decide to venture into the role of the hospital CNA, also referred to as a patient care tech. So here's the difference. In the hospital, things move faster. Patients there are more acute, meaning they're often very sick or recovering from surgery. Your tasks may include checking vital signs more frequently, helping with mobility right after procedures, preventing infections, and assisting the nursing team with urgent patient needs. And guess what, everybody? Niffy passed her test. Congratulations. Thank you so much for sharing. All right, so today's practice test is designed to sharpen your skills specifically for the hospital environment where time management, observation, and teamwork are everything. And so we're going to get started right now. Go ahead and get pens and paper. You'll be learning a few new terminology or terms today. So before we begin, let's find a quiet space to focus. Have a notebook or scratch paper ready. Read each question carefully. Think like a mental health technician, but think like a hospital level CNA. Plus, trust your instincts. You already have the heart for patient care. Here we go, team. Question number 1. A post-surgery patient has an order for strict intake and output, INO. Why is it important for the CNA to carefully track how much the patient drinks and urinates? A, to help the patient drink more water. B, to prevent nausea and vomiting. C, to prevent the patient from being constipated. D, to check for signs of kidney or fluid problems. Why would you be monitoring I's and O's when you're working in the hospital? All right, Niffy, that is so awesome. If you could put in the chat, how did you keep the confidence after failing the exam twice to keep studying? And so thank you for letting people know that our videos really help. I appreciate that. But we are so proud of you. Congratulations. The third time was the charm. You did not give up. And next stop is nursing school. All right, everybody. So for question number 1, if you chose D, as everybody did, you're absolutely correct. So post-op patients are closely monitored for fluid balance to ensure proper kidney function and to detect any signs of complications such as fluid overload or dehydration. Question 2. You notice a post-operative patient's urine output has decreased significantly over the last 4 hours. What is your first action? A, increase fluid intake. B, check the patient's catheter for kinks. C, report the finding to the nurse immediately. Or D, document the output and continue to monitor. And Raven and Jennifer, you're going to do great on your test, so no need to be nervous. We know you're prepared. All right, so your patient's urine output has decreased. Do you want to give them fluid? Do you want to check for kinks in the tubing? Do you want to report the finding to the nurse? Or do you just want to document it because that was expected? What do you think? And we're torn between B's and C's. You're so welcome, Elaine, and congratulations. You all make our hearts melt. Elaine passed the national PCT exam. You go, girl. All right, so because it has significantly decreased over the last 4 hours, I am torn between B and C too, but for this one, it says the answer is C. I know why you want to check for kinks, but we're going to assume that in this instance, there were no kinks. The urine was flowing fine, and now it did not gradually decrease, it just suddenly decreased. And so decreased urine output can indicate serious complications such as kidney failure or fluid imbalance and needs immediate attention from a nurse or physician. And again, I do understand as a CNA one, the first thing we teach you is to troubleshoot, start at the patient and then work your way down. So you'll be checking for kinks. But if this patient, maybe they're not moving, the question didn't say all that. But, if the urine increases significantly, there are no kinks, you want to let your nurse be made aware. Our next question, team. A patient just returned to the room after surgery with general anesthesia, meaning that we used medication to put the patient in a comatose-like state. So this patient was sleeping during surgery. How often should the CNA expect the nurse to check the patient's vital signs right after surgery? Would it be every 4 hours until the patient wakes up, every hour for the first shift, every 15 minutes for the first hour, or as ordered, only if the patient says they feel dizzy? And you're part of the nursing team. And so the order will be written. You're going to be right there with me. I'm going to have you set the frequency on the blood pressure cuff. How often would you have that blood pressure cuff measure the blood pressure? Every 4 hours, every hour, every 15 minutes for the first hour, or only when the patient complains about dizziness? I couldn't trick one of you. You all are so smart. It is C. It is every 15 minutes for the first hour. So after general anesthesia, patients are at a higher risk for breathing problems, low blood pressure, or slow heart rate. That's why the nursing team checks vital signs more frequently, usually every 15 minutes during the first hour, to catch any problems early. CNAs assist by reporting changes and helping monitor the patient. Plus, if you've been trained, you'll be helping to set up the frequency on the actual blood pressure monitor. Next question, team. Great job. Question number 4. A patient with a stage 2 bed sore refuses to eat meat. Which of the following is the best source of protein to help the sore heal? Would it be applesauce and crackers, mashed potatoes and gravy, butter and toast, or legumes? Not everybody will eat meat. Some patients will be vegetarians. Others, maybe because they don't have their dentures, they will just prefer to eat something else. So if they're not going to eat meat as their protein source, what would be something that you would encourage? And if you chose D, you're absolutely correct. So legumes such as beans, lentils, and peas are excellent plant-based sources of protein. Protein is essential for repairing tissue and promoting wound healing. Patients with pressure injuries or bed sores need extra protein to help the skin heal. The other options listed are low in protein and will not support healing, as well as legumes. Hey, Aisha, I'm happy that you caught us. So for phlebotomy, I am not sure because I need to start teaching some of the nursing courses. So I'll see if Nurse Jackie can do phlebotomy on Monday. I just need to check with her first. So I will post it. I will make sure that my next video after my nursing video will be phlebotomy. But if you don't receive your notifications, if you don't have them turned on, you won't be notified of the phlebotomy course. So, all right, let's go to our next question, team. Question number 5. A patient has a Jackson Pratt JP drain post-operatively. What is the primary purpose of this device? Is it A, to administer medications directly to the wound site? B, to drain excess fluid and reduce the risk of infection? C, to provide a route for intravenous fluids? Or D, to keep the wound site dry? Why would a person have a Jackson Pratt drain? If you've never seen one before, why would a post-op patient have a drain? You're going to see so much when you're working in a hospital. I am so excited for you, because if you chose B, ding, 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 you got it right. The Jackson Pratt helps to remove excess fluid from the surgical site, reducing swelling and the risk of infection. So you all, when that drain is half filled, you're supposed to empty it, okay? And so there's a little valve that you would open, you would drain it into a little small specimen cup, and while the walls are touching each other, while you have it compressed, you reconnect it. I shouldn't say reconnect it. You put the plunger back inside, and that is going to help more fluid fill back up. And so on post-op day 1, your patient would have more drainage than they would on post-op day 2. And now we'll talk about the different colors in a few moments, but you're monitoring the quantity of drainage, and you're also monitoring the color, and you'll let your nurse know if there are any changes. Question number 6. What should you do if you observe bright red blood in a patient's drain 24 hours post-surgery? A, notify the nurse immediately. B, nothing. Bright red blood is normal post-op. C, document the finding and continue to monitor. D, remove the drain and apply a new one. So what color blood would we expect to see 24 hours after surgery? Would you be concerned if it was bright red? All right, revealing the answer in 3, 2, and you all are right. It is A. Bright red blood indicates active bleeding. We usually have the dark red blood after surgery. So bright red blood could indicate active bleeding, which is a medical emergency that needs immediate attention from the nurse or physician. All right, so this is your patient team. Oh my God. So this is Mr. Lucas, and he has a lot going on. So Mr. Lucas is in ICU room 3, and he just had an open heart surgery. So you're like, why am I there? You are there because you were the best tech on the floor. And you know what they did? They floated you to the ICU. So here's your question. A PCT is floated to the ICU and is assigned to assist a post-operative patient. The patient asks for a glass of water, but the sign above the bed says NPO. What is the best response by the PCT? A, let me bring you a small amount of ice chips instead. B, I'll bring you water once you finish your pain medication. C, I'll ask the nurse if you can have water. Or D, I'm sorry, but you can't have anything to eat or drink right now. We're torn between A's, D's, and C's. We're all over the alphabet. So you all, what does the NPO sign mean? You have to know your medical abbreviations. Oh, D's have it. There are so many D's now. So you all are absolutely right. Yes, you don't have to notify the nurse. You see the sign. You can read the care plan. The patient is trying to trick you. You're the newbie there. You're the one who just floated. You don't pay attention. You're scared. So they're going to be like, hey, can I have water? And you're going to be like, absolutely not. But you're going to say it more sweeter than that. So NPO means nothing by mouth. This order is typically in place for patients recovering from surgery or waiting for future procedures. It helps prevent choking or aspiration. The PCT should not give food or drink or make decisions about what the patient can have, such as ice chips, but you can politely reinforce the NPO instruction. It is also within your scope of practice to communicate this to the patient. The nurse has already told them. They just wanted to ask you to see if you'd be crazy enough to give it to them. And, after you tell the patient that, again, just go check the order just to be sure. But if that order still says NPO because this patient is post-op, you're going to have to enforce that order. Great job, team. I'm so proud of you. Question number 8. How often should you reposition a bed-bound post-operative patient who is on a rotating bed/mattress to prevent pressure ulcers? So yes, you all, they have beds that move, they have beds that shift. And if your patient is on a rotating bed, would you reposition them every 1 hour, every 2 hours, every shift, or only when providing perineal care because the bed repositions the patient? How did I not trick any of you all? And then, Marlene, we will get to your question next. Oh my God, you all are so freaking smart. So yes, even though the patient's on a rotating bed with a rotating mattress, you still have to change their position every 2 hours. I am so proud of you. And so for Merlene, what's the difference between a PCT and a CNA? So a CNA is the basic level caregiver who doesn't do anything invasive, who does not perform sterile technique, so they cannot insert catheters. Usually your PCTs are going to be limited to home care, working in nursing homes or assisted living facilities. But once you have experience as a CNA, you can either take a course to become a patient care tech, or you can go apply at a hospital with your CNA license. And because the hospital is going to more than likely need you to do more than what a CNA does, let's say they're going to need you to learn how to do EKGs or insert catheters, which means you have to perform sterile technique. They can't call you a CNA. They're going to change your name and change your job duties. Your new title will be a patient care tech, a patient care associate, but that would be the hospital level CNA. And so yes, CNAs can work in the hospital. It's just that once you're there, the hospital will not call you a CNA. So you have the license, but a different title. I hope that helped. All right, so let me hide that. All right, so question number 9. Which of the following is a sign of infection at a surgical site? Would it be increased warmth and redness, decreased drainage, bruising around the area, or itching at the site? What is a sign of an infection at a surgical site? I know, and I see so many familiar names. Hello, everybody. And almost everybody got it. So a sign of an infection would be increased warmth. Some people could have bruising after a surgery, so that could be normal, but increased or around the surgical site. So increased warmth, redness, and swelling at a surgical site are signs of infection and need to be reported to the nurse immediately. Question number 10. A CNA is checking a patient's vital signs and records the following. The heart rate is 112 beats per minute. The blood pressure is 88/52 millimeters of mercury. The respiratory rate is 26 breaths per minute, and the oxygen saturation is 91% on room air. All right, you all, put it in the chat. How many of those vital signs are abnormal? You're checking your patient's vital signs and you see a heart rate of 112, a blood pressure of 88/52, the respiratory rate of 26, and an O2 set of 91%, and I'm all the way down the hall. How many of those vital signs are you going to inform me of? You're going to probably get me pretty fast. All right, so I see someone says 3, Natasha says 3, Vanilla Bean says the heart rate. So you all of them are abnormal. Remember, heart rate 60 to 100, systolic blood pressure usually 100 up to 140. That's right, Myla. Myla has it, you all. And Lanita. So Myla and Lanita have it. You have to report all of those. They're all abnormal. All right, so make sure you go back and study your vital signs. And if you stay to the very end, you're going to see a QR code, and I will give you a website, which will not only give you these slides to this video presentation, but it's also going to give you a vital sign study guide that you can use, and it's free. So just stay to the end, and I will give you those resources. All right, so let's go back to our question. So you noted the vital signs. Which conclusion best explains why these vital signs are concerning? And we are not trying to make you nurses. We are not. Secretly, I am, but I need you to stay within your scope of practice. But I need you to know what's going on with your patients. So the best CNAs and the best nurses always politely ask why. So why would the patient have those vital signs? Is because A, the patient may be anxious before a procedure. B, there are expected values for an older adult. C, the patient may be showing signs of infection or sepsis. Or D, the patient is recovering normally after surgery. Why would the heart rate be high, the blood pressure be low, the person's breathing faster, yet their O2 sat is decreased? And that is right, everybody. No sepsis on your shift because you know to get that nurse in the room right away. It is C. Vital signs like low blood pressure, hypotension, high heart rate, tachycardia, rapid breathing, tachypnea, and low oxygen levels, hypoxia, can be early signs of sepsis or a serious infection. CNAs are not responsible for diagnosing, but they should recognize abnormal values and report them immediately. Sepsis can progress quickly, so noticing these signs early can help save a life. And notice how I did not include temperature, because the other vital signs can also help to show you if your patient is getting better or worse. So if the vital signs are abnormal, get your nurse in the room just like you did. Great job. Question 11, you are assisting a post-operative patient to ambulate for the first time. What is the best initial step to ensure their safety? A, encourage the patient to get up quickly to build confidence. B, assist the patient in dangling their legs over the side of the bed first. C, provide the patient with a walker or cane immediately. Or D, call for additional staff to assist with ambulation. What is the best initial step? We have B's and C's. We have a lot of B's. We had a few C's, and revealing the correct response in, there we go. It is B, team. So dangling the legs over the bed, over the side of the bed, helps to prevent orthostatic hypotension or low blood pressure that changes with position, as in when the patient stands up. This helps to ensure the patient does not become dizzy or lightheaded. So if your patient's sitting over on the side of the bed, they feel dizzy or lightheaded, or you think they're going to be unsteady, you can get them back in the bed, and that is when you can call for additional help. And if they were supposed to walk with their walker or cane, you would have read the plan of care before you got them up. Have that available, but they still need to sit on the side of the bed for a few minutes before you stand them up to allow them to use the walker or the cane. And make sure to have something on their feet that will prevent them from slipping. All right, this is a good one. Number 12, a patient is on a clear liquid diet post-operatively. Which of the following items is appropriate to offer? Would it be red Jell-O, applesauce, apple juice, or milk? Let's see if you can think this through, because I know you want to give me two answers. What do you think is the best response, team? I have A's, B's, and C's. A's, B's, C's. Thankfully, nobody chose D. All right, so I'm gonna wait for about 10 more responses. And so I see more B's coming through. I see a lot of B's. I see another A. I see more C's. All right, so this one was a little bit tricky. What I want you to remember is clear liquid. So anybody who chose B, applesauce. Applesauce is not liquid, so it would not be B. Revealing the answer in 3, 2, and you all, the answer is C. Don't give anybody anything red after surgery. So we're going to give apple juice, clear liquid diets like apple juice, clear broth, and yellow Jell-O or green Jell-O, which are easily digestible and help maintain hydration. Those can be given to a post-operative patient who's on a clear liquid diet. However, red Jell-O should be avoided after surgery, especially if the patient's being monitored for bleeding. vomiting, or stomach issues, because it can be mistaken for blood. If the patient vomits and has drainage, red jello can make it harder for the nurse or doctor to tell if it's real bleeding or if it's the red jello that the CNA gave the patient. And so if you learned something new, put a 1 in the chat, everybody. So nothing red post-op, because these patients, they get sick, they vomit. And now I have to try to figure out if it's a gastrointestinal bleed or if it's something that my CNA gave the patient. Great job, team. Let's go to the next one. Question 13. What is the primary purpose of sequential compression devices? We call those SCDs in short. In a post-operative patient, is it A, to relieve leg pain, B, to decrease pedal edema, C, to improve sleep quality, or D, to prevent deep vein thrombosis or DVTs? Why do we have you put those sleeves that squeeze on a patient's legs? And the nurse goes wild because everybody got it right. Nobody wanted to choose B. I mean, nobody. If someone has pedal edema, their feet are swollen, you elevate those on the pillow. But usually your patients who are post-op are going to have DVTs, because when they are in the bed, they are at risk of blood clots, especially in the legs. So SCDs help to prevent DVTs by promoting circulation in the legs, thus reducing the risk of blood clots. Great job. All right, question number 14. If a patient's surgical dressing site is saturated with blood, what should be your immediate action? I mean, this dressing is bloody, like blood is oozing out the dressing. Yes, you got your gloves on. You're like, okay, what do I do until the nurse gets here? What do I do? All right, so do you want to A, remove the dressing and apply a new one? B, reinforce the dressing with more gauze? C, elevate the patient's head. Oh my God, were they bleeding out their head? Or D, notify the nurse immediately. What do you want to do, team? All right, so that's why we have you take all those courses on bloodborne pathogens, while we teach you how to use PPE, because a consequence of you having a surgery is that you can, 1, get an infection, or 2, you can bleed. And so that's why we also do typing screens, etc., before surgery in case the patient needs a blood transfusion. And so for this one, you all, for 14, if you chose D, you know the answer, because a saturated dressing may indicate excessive bleeding. Maybe the wound came open. All right, so that requires immediate assessment and intervention. Your nurse is going to come in, and then, of course, she's going to call that surgeon. All right, look at this image, everybody. Yes. So, everybody, what is this? What are we looking at? Let's see if we can get a couple of you all to put it in the chat. All right, give you about 30 seconds. All right, 20 seconds. And 10 seconds. So we have infection, we have catheter, we have excessive urine. And so here's the question. A CNA notices that a patient's urinary drainage bag is full. So that particular part that you were looking at is called the urinary drainage bag. It is full and bulging with urine during the morning rounds. What is the correct action to take? A, clamp the tubing to stop the flow of urine until the nurse checks it. B, empty the drainage bag into a clean container, measure the amount and document it. C, disconnect the catheter tubing to allow the urine to drain faster. Or D, report the previous CNA for not doing her job. All right, what do you think the correct response is? You are making rounds and you see this. What do you do? And everybody chose B. I know you're ticked off at that previous CNA. Life happens. But yes, you have to empty it, you have to measure it, and you're going to document it. So when the urinary drainage bag is full, it should be emptied to prevent the backflow of urine, which can lead to, I think Ms. Benita said, infection or bladder injury. The CNA should carefully empty the urine into a clean, calibrated container, measuring the output, record it, and report any unusual findings, such as foul odor or blood, to the nurse. CNA should never clamp tubing, disconnect catheter equipment, or press on the patient's body, like if you were trying to maybe like press on their stomach to get the extra urine out. But remember that the bag will not collect any more urine because it is full. So you have to empty that. I would then, just nicely go let the nurse know, hi, Nurse Eunice, I came in. There was over a liter of urine in the bag. You'll know what a liter is. It's 1,000 mLs, because you're probably going to have to empty that twice just to get all of that urine out. I'm not sure if the previous CNA did her intake and output. I'm not sure what happened, but I want to let you know that this is how much urine the patient had at the start of this shift. And now you need to be checking, because maybe that patient has diabetes and right now they have polyuria to where they're putting out a lot of urine. That person's urine was a little bit darker, so it does not appear as if they're overhydrated. But my point is, you emptied it at the beginning of your shift. You still need to monitor it and empty it again whenever it becomes halfway full and or at the end of your shift. So you still have to empty it at least one more time. All right, question number 16. A CNA is helping a patient who had a cast placed on their arm earlier today. The patient says their fingers feel numb and tingly. What does this most likely mean? A, the cast is helping the arm heal properly. B, the patient's just nervous and imagining the feeling. C, the cast may be too tight and cutting off blood flow. Or D, the patient needs to reposition their arm and move their hand more frequently. They just had the cast put on earlier today. What do you think would be the best response from a CNA? I'll give you about 5 more seconds. And Diana and Nellie and Carol and Vanilla Bean and Madeline and Uma and Judy, you all got it right. Yes, it is C. Hey, those casts can start swelling. So they have tingling and numbness because their circulation's being cut off. So tingling and numbness are warning signs that a cast may be too tight. This can reduce blood circulation or press on nerves, leading to serious complications like tissue damage or permanent nerve injury. It is critical for the CNA to recognize these symptoms early and report them to the nurse immediately. Simply repositioning the arm will not fix the problem, and assuming that the patient is imagining the issue could delay necessary care. Question 17. A postoperative patient is receiving oxygen therapy via nasal cannula. What is an important aspect of care for this patient? A, ensuring the nasal cannula is positioned correctly and monitoring oxygen levels. B, increasing the flow rate if the patient feels short of breath. C, removing the nasal cannula during meals. Or D, turning oxygen off when the patient is sleeping. What is your duty as a CNA or PCT? What do you think, team? Nobody wants to be the respiratory therapist and start adjusting oxygen levels? Great job. It is A. So proper placement of the nasal cannula and monitoring of oxygen saturation levels are essential to ensure the patient is receiving adequate oxygen therapy and to avoid complications. Question number 18. All right, I hope you got those pens and papers that I asked you to get earlier, because we have to do some math. During your shift, you measured the following fluid outputs for a patient. Hold up, everybody. Congratulations, Marvelous. I am so proud of you, girl. And you're nearby, so congratulations. All right, so proud of you, Marvelous. All right, so during the shift, you measured the following fluid outputs for a patient. The urine in the drainage bag was 850 mLs. Vomitus in the emesis basin was 300 mLs, and then blood in the JP drain was 120 mLs. What is the total fluid output for the shift? I'm going to go back. You have to total it up. You won't have much math on your CNA written test, but you may see a question or two. So let's see if you can total this up. I'll give you about 10 more seconds. And for those of you who are staying at the end, remember you get a vital signs study guide. You get access to these slides so you can practice with your friends and family members. And I'm revealing the answer in 3, 2, and looks like we have a winner. I think the correct response is C. Carol has it. Carol and Tori were the first ones to give their answers. So great job. And so many of you all are coming through now. So, and here's our rationale. To calculate, you would add all the values together. So if it's liquid and it's coming out the body, we consider that output. So the urine, the emesis or the vomitus, meaning that the person threw up, but we don't use the word throw up in medical terminology if you're a medical profession. The blood loss from the JP drain. And so let's say that your patient also had diarrhea. If a patient has diarrhea, that is liquid stool. You would have to actually measure. You pour it into a separate graduated container from the bedpan. You would have to measure the amount of liquid stool that came out of a person's body. Because if there is more going out than there is coming in, your patient's going to become dehydrated. So that's why we have you monitor the intake and output. All right, so let's keep going because we know the number, but keeping accurate intake and output records is critical for monitoring the patient's fluid balance, kidney function, and recovery. CNAs must measure carefully and report totals at the end of their shifts. Question 19. You are assisting a post-operative patient with ambulation for the first time. The patient becomes lightheaded and dizzy. What should you do? A, use your body weight to help hold the patient up. B, have the patient sit down immediately and call for help. C, offer the patient a drink of water. Or D, apply a cold compress to the patient's forehead. All right, sir, I see that you're lightheaded and dizzy. Let me leave you so I can go get this cold compress and put it on your forehead. So we know D is not the correct response. And I'll wait 5 more seconds. 4, 3, 2, and great job. Everybody got it right. Everybody chose B. Get them on the floor. Sit them down. That's not a fall. That was an assist. And as you are helping to slide them to that floor, you are screaming for help. At no point should you hold somebody upright when they are dizzy or lightheaded. There was a CNA. She was trying to help her patient. She was a lot shorter and a lot smaller than her patient. He fell on top of her, broke both of her kneecaps. She fell backwards. So you try to get that patient to the floor as best as you can without causing injury to yourself. So if a patient becomes lightheaded and dizzy during ambulation, it is crucial to have them sit down immediately to prevent falls or injuries and to call for assistance to assess the patient's condition. Our last question, you all. Question 20. Remember, stay to the end so that you can download your vital signs study guide. What is the main purpose of giving high quality chest compressions during CPR? A, to restart the heart using only your hands. B, to force air into the lungs and help the person breathe on their own. C, to keep blood flowing to the brain and oxygen moving through their lungs. Or D, to help the patient regain consciousness quickly. So why are we doing chest compressions? 1, 2, 3, 4. Why are we doing those chest compressions? 30 compressions. And if you don't have a breathing apparatus, you're going to do it all over again. You're going to keep doing sets of 30 compressions until your nurse gets into that room with the crash cart. And when she comes with the crash cart, that's when we can start adding breaths. So it'll be 30 compressions followed by 2 breaths. And so if you chose C, like all of you did, you are absolutely right. Your chest compressions keep the oxygen that's in the blood. It keeps that blood circulating and flowing. It's going to help to keep blood flowing to the brain, the heart, and the lungs. And once the nurse comes in, we use the bag mask device to give breaths. That's going to oxygenate the lungs. So high quality chest compressions help to circulate oxygen-rich blood to the brain, heart, and lungs. This is critical during cardiac arrest when the heart has stopped pumping on its own. Without good compressions, organs begin to die within minutes. Compressions don't restart the heart, but they buy time until a defibrillator or advanced care arrives. And as we say in each of our videos, team, we know that caring CNAs become caring nurses, and I am so proud of you. And so CNA, PCT, LPN, RN, FNP, DNP, the world is yours. I just need you to start, to get in there. And so it doesn't matter how you start, it matters how you finish. So even if it takes you 10 years to become an RN, just get in there, start caring for people, and love your job. And if you don't like where you're working, you can always find another environment that works better for you. And that's right, Raven. Raven has spoken into existence. Raven says, we will all pass our exams. Girl, we wish you much success on your exam this week. And you all, we have an online CNA exam prep course. It doesn't matter where you're studying in the world. We have videos, practice questions. You even receive a book. So, an ebook, a digital book that you can download. So you can get to that one by going to our website, which is fltraining.com. And there's a QR code, you all, that I promised. And so if you all, I think about 20% of our viewers actually watch our videos from their TV. And so I'm going to also put it in the chat. You can either go directly to my site, which is nurseeunice.com, and scroll down to the very bottom, and you're going to see the free vital signs study guide. Or if you have your phone and you can just scan the QR code on the screen, that's going to take you directly to your free vital signs study guide. And so you all, I appreciate you. I thank you. And let's see, good luck. Everybody's going to do well on their exams. And I will stick around for another 2 minutes to see what questions you have. Mrs. Saskia will be on Thursday doing the translation from English to Haitian Creole. And then Mrs. Jackie will be back on Monday. I will try to come back on Sunday. I will try my best, but I have a heavy week this week. So I'm going to be in the chat if you have any questions. Judy says, shalom all. Shakina's going to be taking her exam on Thursday. And for all of you all who are saying thank you to me, I thank you for being our future caregiver. So I'll see you in the chat. I'm going to let this video end in 3, 2, and bye, everybody.